Jason, again, thank you so much for joining us this morning and coming to talk a little bit about Western Dental and the work we do and the work we do around Medi-Cal dental care services. So my role with Western Dental, I've worked with Western for several years now, really helping and assisting in their partnership development and ensuring that we're not just in the community, but that we're, actually part of that community. And I think sometimes that tends to, sometimes those things don't mix. And, and where we're located, we really are in those BIPOC communities. And so we want to really make sure that we're part of that community and that we're serving the needs of the folks in those areas. And so that's my position has been to help develop those local partnerships as well as at the state level, and has really enjoyed working with Western these past few years. So with that, just to set the stage, I'm going to go ahead and ask my colleague, Edwin Rivera, to come in. He's the vice president for Western Dental, and I'm going to have him go into a little bit more detail about Western. So with that, I will kick it off over to Edwin.
Thank you, Michael, for the introduction. Hello, Jason. And I overheard you talking about weather, so I'm not looking forward for the next few days. I'm going to fly to Seattle, and it's going to be raining every single day when I'm there. So, but oh well, it is what it is, right? So, Jason, later Michael will provide some information about some of the stats, the patients that we see in the Senator's District and all of that. And it's a pleasure to meet you, even though virtually. But thank you for joining us today. I wish this visit would be in person, but with everything that's happening, this is the safest way to do it. And we virtually welcome you to Western Dental. As Michael said, I'm Edwin Rivera. I'm Vice President of Community Engagement and Strategic Alliances for the company. And today we're going to give you a virtual tour of our services, our offices, and everything that we have in our clinics. So with us today, we also have a few members of our team. We have Tiffany Tucson, who is our operations director for the region, and it also lives in San Diego. So that's Tiffany.
Hi there, Jason.
And then,
how are you?
Hello.
Yeah.
Very good to see you.
Nice to see you. Thank you for this time.
Yeah, and Tiffany will be talking about some of the details of the clinic operations. And then we are also lucky to have our regional clinical director, Dr. Sumelda Sen, who will later talk about clinical aspects of the dental office. And Dr. Sen is even dressed as a dentist today. So you
I'm
look at that.
pretending to be a dentist today.
A working dentist, yes.
Welcome, Jason.
Yeah. And Dr. Sen has been with us for throughout his entire career. So he's not only an expert in dentistry, but he's also an expert on Western Dental. And here at the company, we strive to be part of the communities, like Michael said. But before I go into all of that, I would like Jason to introduce yourself and tell us a little bit about you and what the work you do for Senator Atkins.
Well, good morning, everybody. Thank you for calling this meeting, Michael. I work my name is Jason Weiss. I work in healthcare issues for the Pro Tem. I started with her in 2012 in the assembly. So we went through the assembly side, the roller coaster of speaker, stayed on for Senate, and now we're the Pro Tem. So it's very enjoyable.
Great.
And before that, I worked with another senator for about a decade. So always in San Diego. I try to stay with the district. Tiffany, it's hard to leave.
Yeah, I would say the same thing if I would live in San Diego. It would be very hard to leave. I go there very often, so as Tiffany knows, I visit her almost every month. At least I visit her region almost every month. So that's a very important region for us. And like I said before, we strive to be part of the communities that we serve. And that is why we engage in partnership with local nonprofits, as well as organizations such as Chambers of Commerce, Mexican consulates, and elected officials such as Senator Atkins, for which we make ourselves available for any oral health questions that they might have. So we also like to participate on any events that you might have with your constituents. So we make ourselves available. Many times we think about oral health, and it's always in the back of our minds. It's not really in the forefront like the physical health is, and forget that the mouth is part of the body. So you are on health, Jason, so you know what I'm talking about. So in San Diego, we are active participants of the Health Department's Oral Health Coalition. it's led by Dr. Ollinger at the county level. And we also partner with schools to educate students and parents about different aspects of oral health. We think collaboration with this groups is extremely important in order to bring this important message about oral health for our communities. So today, our company president, Jeff Miller, is not able to join us physically with us, but we have a little video that we're going to share that he has a little message for us. So let's leave it up to Jeff.
Hi, I'm Jeff Miller, president of Western Dental and Orthodontics. Thanks for joining us today for this virtual visit. We wish we could be together so that you could see the smiles of our team members and our patients in person, but that day will come soon. Western Dental has provided high quality dental care for a really long time. In fact, our first office was opened 100 years ago in Southern California. We've grown quite a bit since then. We now have 240 offices in California and 340 offices in 5 states. We have great people who work here. We employ over 5,000 team members. Our doctors, hygienists, assistants, technicians, and all of our staff live right here in the communities that we serve. We have over 1,100 dentists. We have general dentists and orthodontists, but we also have a network of oral surgeons and board-certified specialists. We're unique in that we provide comprehensive services, not just general dentistry, but specialty care as well. And we can provide it across the lifespan. We treat kids on their first birthday, and we're able to address the unique needs of older adults. We are proud to accept most forms of insurance, including Medicaid and Medicare. We are the largest provider of oral health care services to the Medi-Cal program in California. We've been honored to work with the state over the last decade to transform the Medi-Cal dental program. That's resulted in hundreds of providers joining the program and increased access to oral care services, both for kids and for lower-income adults. We're excited to continue to work with the state as the Cal-AIM program transforms Medi-Cal over the next decade. On behalf of all the Western Dental doctors and employees, I wanted to thank you again for joining us and spending a little time with us. Look forward to being with you again really soon.
Perfect. So virtual thank you to Jeff. So Jason, before I get into the actual tour of the clinic, if you have any questions for us so far, I wanted to make sure that we thank you and thank the senator for all the work that she has done, especially around Prop 56 and all these different things that have happened at the state level that have helped us as a company to increase not only our reach to the community, but increase services especially for Medi-Cal patients. So thank you so much for that. So any questions so far?
I think I will hold most questions to the end. I do want to give a shout out, if you could forward my appreciation to whoever produced the video, working on staff with the Pro Tem. I know how much, I didn't know if someone's leading with an iPad while he walks or how they do it, but I know there's a lot involved in something like that. So happy to
There is. And actually the person who produced the video is listening to you because he's in the green room. He's the one who connects us with all of this and runs the behind the scenes. So
well, good job.
Thank you on his name. Thank you. Okay, so now I want to give you a little virtual tour of the office. And actually this video that you're going to see, all of it was shot in one of the San Diego offices, our newest office in San Diego in Lemon Grove. So it will show you the operations of our clinics, basically. So this is, as Jeff said on his video, we have been serving the community for over 100 years, and we are one of the nation's largest dental providers and the leader of accessible and affordable healthcare. We have in California 240 locations, and 16 of them are in San Diego County, as well as offices in Texas, Arizona, Nevada, Alabama, for a total of over 340 offices, and as we continue to grow as a company. Western Dental provides a full range of dental services. We employ over 600 doctors in California and over 1,000, including the states that I mentioned previously. Our doctors are licensed and board certified dentists who also besides general dentistry, they have other services that include oral health, surgery. We have, and that is one of the reasons that we are so proud to call our clinics a dental home for the whole family. We're also proud to say that we have always had a state-of-the-art safety protocols, which have been enhanced during the last year and a half and have helped us maintain both patients and team members safe throughout this pandemic. We were one of the first large practices that opened back in July of last year, and we are fully open now, running 100%. We are the largest provider of medical dental in California, and we will help our patients finance treatment that might not be covered by medical, such as orthodontia, for example. So we can make sure that they get the needed treatment within their budget. We are also open non-traditional hours, which is very important for our community. We're usually open Monday through Saturday with late afternoons and early evening appointments available. So as you can see, we are more than a dental clinic. We are a partner of the community who care about their oral health and want to educate them on the importance of keeping your mouth healthy. So now I would like to introduce Tiffany, who will give us some specific details about the clinics in our region. So, Tiffany.
Thank you, Edwin. Yes, Jason. So I'm the director of operations for the San Diego region, the one who oversees those 16 offices in San Diego County. And, just like Edwin said, we do like a plethora of services, not only general dentistry, but periodontic. We have perio, as well as oral surgery, as well as ortho that he did mention, endodontics. We also provide, just as Edwin mentioned, healthcare for any demographic, which is what makes me so passionate and feel so proud to work for a company that is really able to allow dentistry to be used throughout no matter your pay scale. As you can see, Dr. Sen is suited up for dentistry today. Not only does he lead our district as a clinical director and the go-to for any of our doctors when they ever have questions, but he is also hands-on in the field. He places implants, as well as he's been here for 23 years. Doctor, you have some words for Jason?
So yeah, it's not actually 23 years. It's actually 28 years, and my wife has a huge question for myself. Am I that bad or am I lazy? Only I know the answer why I'm with this company for 26 years, and I tell you why. Uh, I like the vision of this company. It allows me to be every corner of the city, whether it's the inner city or remote location. We are accessible. We open ourselves from Monday to Saturday from 8 o'clock to 8 o'clock. So welcome any patient into our clinic. Why we like Western so much? I like Western so much because we believe in prevention is the best treatment before it goes into any other kind of specialty work or any advanced work. We like to stop that progress, and it starts very early on. It can be 1 year old patient, or if everything is fine, it could be 1 year old's mother, to tell them what to do, what not to do, so that they can have a good and healthy life down the line. Because dentistry is not just 32 teeth. It is way more than 32 teeth. It is linked with your overall health, your diabetes, blood pressure, so on and so forth. So we are very, very conscious about it. And going back to our Western dental, the way we operate, we truly believe in a dental home. What is a dental home? You come to our office, you bring your wife, your companion with you, you bring your kids, you bring your mom, dad, brother, sister. Everything is a one-stop service here. We do general dentistry, we do all the specialty work you can actually think of under the same roof. Otherwise, everybody, any other patient, will be running from one place to another place looking for a specialist. So that really, really makes us unique. And also, another thing that really makes us unique is, as I mentioned, you can be seeing us in every corner of the city, right? But we are not there just to do Mickey Mouse dentistry. We are there to provide the quality care to every single patient, regardless of their income, regardless their anything you can think of. In other words, we treat every single patient exactly the same way they should be treated, if they're in Beverly Hills or they're in the inner cities. There is no differentiation here. We provide implants, we do sedation, we do root canals, the way every high-end patients, quote unquote, will be treated. We want to provide that to every single patient and to our community. I think that is what makes us unique. And I think that is what makes us special. And it is never about money. Yes, money is important to all of us, but it is never about money. I truly believe you do the right thing and the right thing for the patient. Uh, you do a really good job. And I always tell my doctors, do not do anything that you cannot go home and sleep peacefully. You got to go home, tell yourself, you know what, I did my very best, regardless of the outcome, and I did the best service to my patient. And that is the reason I'm with this company for 28 years, and I'm hoping to stay a few more. But more than that, I would love to serve your community, Jason. Any need you have for your district, for your any patient, please, you're more than welcome to reach out to us. We'll be happy to provide any need you have, starting from 1 year old to 95 years old. Thank you for having me, and welcome.
Thank you, Dr. Sen. That was awesome. So, Jason, now you see why Dr. Sen is one of our favorite dentists, right? He's like,
absolutely understand. Dr. Sen, where is your practice at?
I tell you what I do. I have 65 practice under my portfolio. So I go to all 65 offices. I train my doctors based on the vision I just mentioned. And I also go and I do implant surgeries for the patients where I cannot find a provider to place implants. So you can see me in San Diego, you can see me in Inland Empire, you can see me in LA, you can see me in Orange County. I'm everywhere.
yeah.
All over Southern California, I understand.
Yeah.
There you go.
Yeah, that's where he's at. And he mentioned about, taking care of the whole family. And when we started working with the Oral Health Coalition in San Diego, one of the reasons we joined the coalition was because, I had a meeting with Nancy and Dr. Ollinger there, and they were saying, we're struggling for pediatric dentistry in San Diego. We don't have a lot of pediatric dentists that accept Medi-Cal. So that was the main reason we joined, because we are the largest medical provider in the United States. I'm sorry, in California, almost the largest in the United States, but the largest in California. And in San Diego, we see the whole family in one place. But we also in San Diego have 2 clinics, excuse me, that are pediatric only clinics. So that's something else that we have there in the area that we are proud to say we have. So, and with that, Michael, I don't know if you're ready to talk a little bit about the number of patients that we see in the district and all that.
Yeah, absolutely. Well, as you could see, Jason, it's really a joy to work with everybody in on this call and with this company. There's just such passion, I think, to help those, and it really is instilled in everything that Western Dental does. And as Edwin mentioned, like where I live, there's 2 dentists in El Dorado County that accept Medi-Cal. And so it's extremely difficult for folks here that get Medi-Cal services to be able to get those. And so it's the great thing about Western, that they have the reach and the ability to be able to do that. And when the rates were adjusted with the Prop 56 funding, it really, not just for Western Dental, but for dentists across the state, to be able to start accepting and be able to help those patients in their areas. And then, just for example, so in your district, there's about a little over 150,000 population-wise that are Medi-Cal eligible for services. And for Western Dental, we kind of took the numbers from late 2020, kind of when we were getting back into the swing of things, through today. We've seen about a little over 66,000 patients in the San Diego area in your district, and within that time frame, about 14,000 new patients. And so we've really seen that increase in patients, with that investment that the legislature and the governor put into Medi-Cal. We've been able to see those new patients, and we're really looking forward, of course, as well, with the new age 50 and older for the undocumented community to be able to now receive these services as well. And that's another thing that Western Dental does, is we make sure we have that cultural competency, that bilingual, so that we have bilingual in all of our offices as well, so that we're able to speak in their own language as well, and be able to provide those services. So we're happy to share the data with you as well, Jason, so that you have it, or if you want to look at any of that. But we just wanted to give you that little snapshot of kind of how many folks in your district, and then how many people that we're serving. And we're always looking for ways to ensure that we're getting we're reaching out to everyone that's eligible, because I think a lot of times people think, okay, I get Medi-Cal, but they don't understand that there's dental as part of that as well. And so we do our best to try to with our outreach to get that message out there too.
Yeah, well, thank you for the numbers, Michael, because that was the first question that I had on my list, is how many clients do we have in district, and how many have you served? So thank you for that. Now, regarding the eligibility of the availability of Denti-Cal, one, that it's an actual covered benefit now, because it hasn't been. It's been taken off the table, which I think is one of the most cruel things that had happened in budget cuts. So when your clients came back, when the benefit has been extended, what was the overall condition of your clients at that point, and has it improved? I'm sure there was a lot of backup work that you had to do in order to get people into a reasonable condition now. And how's the population now in your estimation?
Yeah, and I would like Dr. Sen to answer that, because he has more of the clinical view. But from my perspective, we can see how people totally neglect their oral health. Even now they have benefits, they neglect it because it's they wait until it hurts to go to a dentist, and once it hurts, it's kind of too late, because that means that you have an infection, you have all these different things. So that is one of the reasons that we are encouraging people to come in, to make sure that they come in twice a year for their cleaning, because the cleaning is not only cleaning their teeth, but the dentist will make an entire evaluation of your oral health, and sometimes your systemic health also, because we can many times we can see the person has diabetes and might be undiagnosed. We can see many other things that are connected with the mouth on those patients. So Dr. Sen, I don't know if you have any comments on that, on the how we see the oral health of the community improve once they start coming to a dentist, which is the case with the medical dental, the restoration of benefits for adults specifically. And you're on mute, Dr. Sen.
Yeah. As I said this before, the prevention is the best treatment, right? I mean, you do not want to go to this far. So I tell you what, today I'm in Hawthorne. It's close to Los Angeles airport. And I have this 40-year-old patient, and she's extremely nervous. She's crying. I have to give her Valium last night, put her Valium right now. Guess what the saddest part is? I'm taking out all her teeth and I'm placing 4 implants. I mean, this is the sad part where the dental care is not accessible to everybody, or when the dental care is accessible or the people are actually neglecting their health. So I get to say this quite often, but I tell you the way it happened, once the patients start coming to the doctor, at least for Western Dental, we have a process here. We get to see them back every 3 months, every 6 months, every 1 year, just to make sure they are in a right track. And we've been able to minimize the extensive work this patient would be needed. But I tell you what, during the COVID time, it kind of got worse because we had to shut down our operation for some months. So right after we opened it, there was a huge influx of the patient in pain. Oral health has deteriorated and a patient has neglected, so on and so forth. At that time, we had to boost up our doctor situation specialists, really to make things under control. But once it is kind of normal, and I truly believe things are getting kind of normal now, for the population we serve, or at least for the patient we can bring him to our offices, they're doing a lot better. They're actually feeling a lot better. But the question here is, how many patients are actually coming in, or they even think, or they even know about their benefits? In my mind, a lot of these people and the patients, they don't even know they have a benefit to go to the doctor and take care of themselves. So it is really the awareness, and we as a leader of the community, we are responsible to spread that awareness to the patients. And please make sure they're actually visiting their dentist at least once a year, if not anything, regardless you have pain, infection, or something like that. And if we can do that, I think we can do a really, really good thing for the community going into the future.
Thank you for that, Doctor. And I neglected to express my appreciation for your outreach to the underserved community. I know it's important; it's very important to the Pro Tem that we provide services to underserved communities. As I think that most people on the call probably know the Pro Tem's personal background, a lack of healthcare, and relying on general clinic services. And she got braces, I think, when she was 30 years old. So the dental care is very important and personal to her. So really, we do appreciate what you do and your outreach to underserved communities. So locally, Edwin, you said that you're working with the County Oral Health Commission. Mm-hmm. And in that partnership, have you been able to expand outreach and connect to more clients locally here in San Diego?
Yes, and Tiffany, do you want to talk a little bit about the work that we do with the Oral Health Coalition?
Yes. So, well, the first year that we were able to join that coalition, we met as a community. We had some key speakers as far as the dental world is concerned speak, and we were able to break out into small groups where we really game planned on how we can further educate the community on oral health, and not only educate them on that, but educate them on that oral systemic link between oral health and overall health, and how do we bridge the gap between the medical facility mentioning everything about body health, but not very very assertive in the aspect to oral health being such as important. We've also worked with First Five. We've gone to numerous schools throughout the San Diego district, charter schools, private schools, where we have this program called Adopt a School. And it's a few dollars that we can give the school that they can utilize to whatever they want. And all we ask is that, let us come in and speak to the kids. Let us give you goodie bags. Let's educate our children so that way we can get them proactive and, cognizant of that importance when it comes to our oral health. Those are just a few. I know that, COVID kind of put a real big damper on all the progression that we have been making. And, everybody after COVID, we've been meeting online on Zoom calls every once a month, Fridays. So that's been really great because we, again, can still have those avenues to, try to work with different dentists, try to work with different members in that San Diego County. Nancy Starr has been a huge front runner for that. As well as we just did a recent GACA's Give Kids a Smile event that was also coordinated from the San Diego Health Coalition. That's how we were able to connect with them. And it was seeing, patients with no insurance. They would come to the office and those kids would get a visual exam. We would give them, at home items, toothbrush, floss, things like that, as well as that education, as well as, us trying to bring them on board as, a lifetime patient. So it's been real awesome to see, San Diego just really work within the community and other providers, and just to see the passion that's out there, and just to know our outlook and the game plan for our future.
And
yeah.
Oh,
go ahead, Mike.
Yeah, I was just going to say, Jason, and certainly, we certainly want to partner with you, with other legislators, elected officials. If you have other CBOs or nonprofits, and other organizations that are in the community that we might be able to do partnerships with. We certainly want to have that conversation and see what we can do so that we're, getting in at that grassroots level as well, so that we are getting the word out as much as we can. So we always welcome those connections as well. So appreciate that.
Thank you.
Yeah,
Thank you,
and then-
Michael. Thank you, Tiffany. I definitely think that I, the Pro Tem, probably have a few in mind, and I think we'd like to follow up with you on that one. And then once we do, I don't know, I don't even know if you can call it a corner, but once we round the curve of this whole pandemic issue, I think that having a health fair is something that the Pro Tem has always enjoyed doing, having services to provide dental care, to provide eye care. It's something, and then that whole general well-being, I think it's something that the Pro Tem would certainly like to go and do in the future. So we will reach out at that time also.
Awesome.
Yeah, definitely. We appreciate that. And we, like we said before, we're available and we're willing to help you in however we can. In San Diego County, it's one of the few counties. We work in the entire state of California, and I have a special place in my heart for San Diego, because they really show how much they care about oral health. They have a chief dental officer as part of their structure, which not many counties do. And this oral health coalition really brings all different elements of the community to really discuss that specific topic. So it's very, very, a very good job that they do there. So we're proud to be part of that. And then once things get a little bit better, we would love to have you and the Pro Tem to come to one of our offices and see it in person. It's not the same see things through Zoom or through this platform, but actually be there and seeing the patients and really understand what we do. So the invitation is there, and hopefully we're able to do that.
Thank you. We welcome the invite and the tour. I know that we took one probably 7 years ago, so I think it's about time that we go out again.
Oh yeah, we have changed a lot in the last 7 years. So
Okay.
Yeah.
Well,
So.
I thank you. I thank you all. Michael, if you got a fact sheet that you could go and forward on to me, that would be great. And if there's anything, is there anything else I can forward on to the Pro Tem, let her know of how we can assist?
I just want to mention, it's really, really an honor just to have this moment with you, especially just being a member of Senator Atkins, and how she's such a huge champion for affordable housing. My mom worked for the Housing Commission for 20 years and then HIDER as well thereafter. So it's real a passion of mine just to speak with you and just to know you're a part of her team. That's awesome.
Well, thank you for that, Tiffany. And it was SB9 was a heavy lift. It was, I think, larger than I had anticipated for sure. And tell me, please, who was your mother so I can share with the Pro Tem?
Nancy Tucson.
Yeah. Okay. I will let her know.
Yeah. Thank you.
Thank you again, Jason, for joining us today. And we're here to help you in however we can.
Yep. So I'll definitely follow up with that information, and again, because we are, such the largest Medi-Cal provider in California, from a policy perspective as well, if the Pro Tem or you ever need information, you're looking at, data, we can provide a ton of data to you as well, as you're looking through policy initiatives. So please think of us as a resource as well on that front too.
Absolutely. We certainly will as things go forward. Thank you all so much for your time.
Thank you.
All right. Thank you, Jason.